What are the best practices when using opioids? So we're talking in this situation about somebody who's been prescribed it. It's best to use it only in acute pain, so for short term. Up to a week is best. Anytime after 1 week, things can become sticky, that they can develop some dependence on it, meaning that they can go into withdrawal if they stop taking it suddenly. So acute pain is the best practice. For chronic pain, however, a lot of people are on opioids, unfortunately, and this is where medical professionals are trying to take people off of it. Now, they're not trying to suddenly withdraw somebody from the drugs, but rather to wean them, to taper them onto lower doses as best as possible, to the point that the person is still able to function. If they lose their ability to function because they're feeling unwell of going through withdrawal, then that needs to be noted by the physician and put back on a slightly higher dose. So for chronic pain, there's other alternatives as well. Now, studies have shown that for chronic hip and knee pain and other joint pain, that opioids in fact don't confer any real benefit over anti-inflammatories. Things like ibuprofen, which is known as Motrin or Advil, and even good old-fashioned Tylenol. So those help, but these are just medications. There's many other ways of treating pain, and it starts with cognitive therapy. It can help with of course the massage therapy, acupuncture, acupressure, chiropractics, physiotherapy, and exercise. A lot of people have joint pains. They tend to baby themselves because they're experiencing joint pain. Like, this is for long-term joint pain, not acute pain, not short-term. And the worst thing to do is to baby ourselves or pamper ourselves and to stop exercising. That's the worst thing to do, because muscles and joints need activity to stay healthy. And to minimize and lower pain, it's actually better to engage in physical activity. Of course, this is let pain be your guide. Don't overdo things. But it is important to accept a certain level of pain as normal, and to be able to cope with it as best as possible. Other best practices are, if a person is using opioids for a long time, they could be substituted over to opioid replacement therapy. So these are two types of drugs. One of them is well known as methadone. The other one is a newer one called Suboxone. And these help this gives the person their life back. So this is the situation where somebody's been on the opioids for for a long period of time, and having troubles weaning off of it. So they can be bridged with these medications. So these drugs help reduce they can completely remove the side effects of with going through withdrawal, but it doesn't cause the same euphoria that the opioids in general do. So although these are opioids, these ones don't have the same euphoria-inducing effects as like Percocet or Vicodin or fentanyl or morphine. And so the idea is to get them on these opioid replacement therapies and then to slowly wean these doses down. To treat pain in this situation, they can be put on short-acting opioids, some long-acting ones, but certainly not the drug of choice if they have been abusing it. Sometimes long-acting drugs are better because it doesn't cause a rapid high, but for some people, short-acting is better. So it depends on the certain person involved. Finally, being able to be open and speaking openly and candidly with your physician is super important. They need to know exactly what's going on, and a lot of people have a lot of shame and guilt about using, and it's a dirty little secret. It's very common with chronic pain patients and opioid users as well. They tend to hide and minimize how much they're actually using. So it's important to be honest and open, because if you truly want to get help for yourself, you need to let your healthcare provider know, as well as your family, to be open and honest. So to summarize, the best practices for being on opioids is to try to minimize the doses as much as possible, to combine it with other analgesics like ibuprofen and Tylenol, and to switch over to opioid replacement therapy if necessary, things like Suboxone or methadone, if a person has had a long-term exposure to opioids and is having troubles weaning off their drug of choice. Finally, communication with their family and healthcare provider is of paramount importance. If you have any questions, please leave it in the comment box below. Thank you.